wait for the one. Is everyone ready? Okay. Just your impression of the questions you got today. I mean, it seemed like an unscripted event. You had a lot of different opinions. It seemed like in the crowd. This experience, what was this like?
Well, again, it's very similar. Earlier in the week, we did 2 telephone town halls, dialogue to 180,000 Wisconsinites. I think it's like our 60th telephone town hall. Very similar comments. People are concerned. I think there has been some scaremongering on this, and certainly one of my objectives is to try and assure people that what we're trying to do is stabilize, for example, core Medicaid that has been made unstable by the expansion of Medicaid to able-bodied, childless adults without pulling the rug out from under anyone. So I'm trying to provide people the assurance that we're trying to stabilize these programs without mortgaging our children's future, and I'm focusing like a laser on trying to bring down the cost of premiums overall, so that people like Janice Fenneman can, people who don't qualify for subsidies can now afford to buy insurance again, and the American taxpayer can actually reduce the amount of the subsidies we're providing without harming those people who need subsidies.
You said you wanted to wait and see what people in Wisconsin thought about these bills before voting on them. Part of the reason why you wanted that delay. But people that are expressing these concerns here, what can be done in these bills to address their concerns? Or, I mean, at this point, are they just thinking that the ACA needs to stay around and there's nothing that can be done for their concerns?
Well, it's not just general constituents, but I'm also talking to hospitals and providers, and I'm talking to a number of different constituencies that are affected by these bills. But again, I think the number one thing we need to do is focus on the premiums. If we can bring those down, it just solves so many different problems, and that was my biggest problem with the Senate bill and the House bill. Not enough was being done focusing on that. Washington, D.C. generally focuses on spending. Everybody concentrates on spending. They use inside the Beltway terms, they talk about slashing and cutting, when all they're really talking about is reducing the rate of growth in spending. And so that's one of the things I'm also trying to do is kind of point out those inconsistencies.
President Trump is urging senators to repeal now and replace later. There is no replacement plan. Are you on board with that?
I think we really do need to have a replacement. I think just repealing right now is probably not an acceptable solution. Now, what I will say, I've heard those proposals repeal with a date in the future to put pressure on us to do the replacement. I could potentially buy into that as long as it was out in the future. And then I would reach out to our Democratic colleagues, which we should have done at the beginning, focusing on the damage done by Obamacare, having them acknowledge you created this mess, but then asking, help us fix it for the benefit of the American public.
Sure. Critics of the free market approach to solving healthcare issues argue that in the past it hasn't really dialed down costs. The 80-20 rule began to kind of address that a little bit. Do you support the 80-20 rule?
You're talking about medical loss ratio?
Yes.
There's been some problems with that, and we are so far from consumer-driven free market competition in the healthcare system. Again, only 10 cents, maybe closer to 11. 10 to 11 cents of every healthcare dollar is paid for directly by the patient. Otherwise, it's being paid by a third party. So patients don't know, and they really don't care what the services and products actually cost in healthcare. We need to reconnect the consumer with the product, pay the product. The free market, consumer-driven competition works in every other area of our economy. We've driven it out of healthcare. I think that really is a big problem. Now, I've never argued that healthcare can all be consumer-driven. That's why we have insurance for the big, high-cost instances and conditions. But the more we can get consumers connected with the payment of the product, I think it really would go a long way toward restraining healthcare costs.
Sure, and the 80-20 rule addressed how much of your premium dollar actually goes to healthcare versus the insurance industry.
Well, again, in the insurance industry, sometimes, depending on the policy, a lot of that administration costs helped constrain costs as well. So again, a big 90-state solution, they look at one metric. It's not particularly perfect. There can be very serious unintended consequences to that kind of rule.
Senator, almost every poll has the Senate bill at under 20% approval by the
That's
national
really popular,
public.
isn't it?
Right? Is that a result of the bill needs to be updated and changed, or do you think the message isn't getting out to the public of what's actually going on with the bill?
I think it's first a reflection of what a big mess we've got, how complicated, and it's not easy to fix. I think there's an awful lot of demagoguery. I think there's been a lot of scaremongering out there. I would say that Republicans probably have not done a very good job communicating it, which is what I'm trying to do, which is why I write columns. I go on TV, I go on radio, I come to places like Platteville here in southwest Wisconsin, try and explain as best I can. But healthcare is extremely complicated. and we've got a really big mess on our hands. So anybody who's ever had to touch it generally does not benefit from a standpoint of a public opinion.